Okay, and so now we have our final lecture on the topic of stress. Specifically today, we're going to be talking a bit more about coping with stress, which is a topic that I kind of introduced in our last lecture, but we're going to definitely expand upon more today. So coping is a cognitive, behavioral, and emotional way that people deal with stress. So it is complex, involves how we think, what we do, and how we feel as well. It's also a dynamic process. So coping is not this one and done thing. Like someone breaks up with you and it's like, okay, I've coped, I'm done. Instead, it's dynamic. It's something you come back to again and again, kind of similar to what Lazarus talked about with his transactional model. So in the breakup analogy, like you break up with someone you loved, you're sad, you're, depending on how it is you like to cope, maybe you're throwing your energy into school or working out, or maybe you're taking some time to cry it out, but you've kind of gone through that initial coping process. But then after that, regardless of how it is you coped, you go out with some friends and, they suggest going to a bar, not knowing that that was kind of the place that you went with your partner, with your ex. And so now you're kind of having a secondary wave of those emotions again as you kind of grapple. And so that's what I mean when I say coping's dynamic. It's dynamic in the way that, as Lazarus said, the reappraisal process means that you're kind of, going back and working through it again and again, and each time it's a little bit different. But even once you've kind of exited that loop, additional cues and triggers can kind of bring up the thoughts again and bring you through the process again. There are several different coping styles, which broadly speaking include the approach coping style and the avoidant coping style. And then under the approach category, we've got problem-focused strategies and emotion-focused strategies, which were things I briefly introduced to you guys earlier in talking about that transactional model. So we're going to talk about what each of these styles and strategies means, and then I'll give you some examples and kind of what this would mean for you as a provider. So let's talk about approach and avoidant first. Approach or vigilant coping is a type of coping in which you are directly confronting a stressor and developing a solution. So this is very kind of problem focused in nature. This is the most effective. There are two different strategies you can use here. So the problem focused and the emotion focused, which we'll talk about in the next slide. Approach is linked to greater health outcomes and less psychological as well as physiological distress. Avoidant or minimizing coping entails withdrawing, minimizing, or avoiding stressors. This includes passive behaviors, namely avoidance, as well as more antisocial behaviors that don't really have anything to do with the stressor. So things like, I'm going to avoid this and go drink or smoke, or I'm going to avoid this and just go have a lot of sex. This also includes things like just kind of fantasizing and wishing the problem will go away without really dealing with it. And so understandably, approach is better and avoidance associated with more negative outcomes. So under that approach umbrella, we again have problem-focused coping strategies and emotion-focused coping strategies. So these are different ways to deal with stressful situations. Problem-focused coping is dealing directly with the stressful situation either by reducing its demand or increasing your capacity to deal with the stressor. So reducing the demand of a stressor means in some ways, if it's possible, to pass off part of the stressor to someone else. So if you are a nurse and you're slammed and you can get a peer to kind of check in on one of your patients, that's a way to reduce the demand. Similarly, you might not be able to hand off any of the work, but you can break it down into more manageable chunks. So a student can break down a project into, smaller pieces with, incremental deadlines, or, I've given this example to a couple of students recently who are really just stuck with the whole perfectionism thing. A couple of student teachers actually who are just really slammed between doing the things they need to do to get licensed as a teacher when they graduate and their student teaching, and they're trying to fulfill all these requirements for their student teaching class at App. And it's like, you know what? I'm not telling you to slack off, but like, you don't need to do all of your assignments 100%. Like, let's just put in 85, 90% effort and like call it a day, turn it in and move on. So that's another way to reduce the demand too, if that's a possible thing for you to do in your job. Reducing your demand by employing that kind of strategy as like a nurse, for instance, probably wouldn't be the best idea. But another avenue is you can reduce the demand by adopting what I call the 85, 90% rule. You can also increase your capacity to deal with the stressor, which is kind of bringing on new resources. So for example, an alcoholic joins AA, or just going to therapy in general, or, going to the doctor in general is going to be increasing your capacity. You're kind of bringing on more resources. This coping strategy typically develops during childhood, which makes sense, as childhood's kind of the time when you start to learn more about problem solving in general. Emotion-focused coping is an attempt to regulate one's emotional reaction to the stressful event. So to kind of process how you're feeling and how you're relating to the stressor. So this one is used primarily when the person believes there is little or nothing that can be done, and when they believe coping skills or resources are insufficient, as I mentioned last time. So this is a good approach when there's nothing else that can be done. This is a good approach when resources are insufficient. So emotion focus is not less than problem focus. It's appropriate in different situations. And this develops more so during adolescence, when you're being hit with all of those emotions and kind of learning how to cope and deal. So which is healthier? It kind of, again, just depends on the situation. Problem focused is associated generally with better health outcomes. The duration is key. Problem focus can work better when the stressor is chronic. When the stressor is acute, even if problem focus made more sense, you can easier get away with emotion focused coping, versus if you're dealing with something chronic and you need problem focused coping, there's something you can do about this. But you're dealing with it via emotion focused coping, that's going to be more damaging, if that makes sense. So you can get away with inappropriate emotion focused coping when the stressor is more acute, but when it's chronic and there's something you can do about it, problem focus is definitely the way to go. That being said, there are plenty of more chronic stressors that aren't necessarily appropriate for problem focus. So again, it really just goes back to what the stressor is and what is the secondary appraisal. Is there something you can do about it or not? And so if there's something you can do about it, do it. If not, then deal with the emotion side of things. So for instance, if you are dealing with a terminally ill family member, you've been dealing with this for years, this person's had cancer. And so for much of it, problem focus made the most sense in terms of like figuring out how to get off from work to take this person to their appointments and care for them and help them make health decisions. But now they're in hospice, which is basically end of life care, where we're just trying to keep the person comfortable. At this point, there's nothing really else that you can do. You are out of resources. You've done everything you can do. And so at this point, it makes sense to kind of shift over to emotion-focused coping. And so which one to use really just depends on the situation. Another thing to be cognizant of is rumination, which is when emotion-focused coping becomes linked with emotional distress and health problems. So this is when a person starts with emotion-focused coping, something that was initially helpful, but they're kind of going around and around. They are thinking about whatever is going on repetitively, and it's not really contributing to a sense of peace or resolution. You're just kind of working yourself up more and more. An emotional cascade is sometimes also a term that we'll use to describe these situations. For a person who is just stuck with their emotions and not in a helpful way, and there is no transition out of emotion-focused coping or to problem-focused coping, if that's a possibility in this situation. So to answer which is healthier, again, it kind of just depends on the situation and that secondary appraisal. So let's talk a little bit more about how you could help patients using these different strategies. So again, problem focus is pretty straightforward: reduce the demand or increase the coping capacity. You can't really do this for the patient, but you can educate and help to promote hope. So you could use the 85-90% rule, like, it's okay. Like, again, and I shared an example of myself with a client. It's like, I'm not telling you to slack off or to just like not try, but like, it's okay to not do your absolute best. Like, you can do 85-90%, still knock it out of the water, still do a great job, but free up a little bit more of your time and your mental resources. That's a great way to reduce demand. Or talking to patients about whether or not it's possible to get someone else in to help, whether that is having your mom come to stay to help you take care of a newborn even, or something like that. As far as increasing coping capacity, you as a provider, have the ability to make referrals. So you can refer people to social services, to mental health resources. You can refer to a nutritionist or a PT or an OT. You can refer to legal services if your patient is in a situation where, like, legal services, like in the Chad Priest TED Talk, like that is really what's going to help this person versus another inhaler, then do that. You can also just kind of talk briefly about the importance of communicating and relying on loved ones, and the importance of the 85-90% rule, and just kind of give, quick little interventions, again, even as, a healthcare provider with no further mental health training. Emotion-focused strategies, we're going to talk more obviously about some of these things, and some of these are things that you could do more in a mental health care setting, but some of these others you could, refer patients to, like, good YouTube videos of progressive muscle relaxation, even though you couldn't walk the patient through that themselves. So relaxation is one such approach that we can use. I have a couple different kind of go-tos for the types of relaxation I like the best. My absolute favorite form of controlled breathing for relaxation is what I like to call an exaggerated exhale. This is one where we take the time to exhale at a longer interval than inhale. The reason this is important versus just square breathing, which is like inhaling for 3, holding for 3, exhaling for 3, holding for 3, you get it, it kind of looks like a square. We're actually taking time to exhale longer. This is important because when we inhale, on a minor scale, we are actually activating our sympathetic nervous system, the part of our nervous system that's responsible for that fight or flight. And when we exhale, we're on a small scale activating that parasympathetic nervous system, that part of our nervous system that's kind of the rest and digest, the opposite of the fight or flight. And so when you tell people to just breathe or take in a big breath, they frequently are taking in a big inhale, and that's not really helping them to calm down. That's just kind of revving them up more. And so, again, I tell people to take a longer exhale, and I'll typically count them through like 3 or 4 cycles in session, just so they can really see and feel how awesome it is. And by walking them through and demoing it, again, it takes 30 seconds. They're more likely to use it because they understand how to use it. You've helped them figure out how to use it, and they've felt how good it feels. So in the spirit of that, I'll kind of walk you guys through a few. So I'm going to use the 3-1-4 method. You can also instruct a patient to inhale for a count of 3 and out for a count of 5, but I like the 3-1-4 better. So sit back, and I'd like you to inhale 2, 3, hold, out 2, 3, 4. Inhale 2, 3, hold, out 2, 3, 4. Inhale 2, 3, hold, exhale 2, 3, 4. Inhale 2, 3, hold, exhale 2, 3, 4. So if you did that with me, you probably felt like you were sinking into your chair a little bit and just kind of coming down. And that is a fantastic intervention for so many different things. I've used that on pregnant mothers during labor. I've even used that on a smaller scale myself, like when we taught in person and I was rushing from one class to another class that started like 15 minutes later in a different building. A lot of times I would just breathe to myself for 30 seconds to a minute, just so like I wasn't out of breath when I'd start lecturing. So there were so many great uses for that particular intervention. Another one that's more time consuming is something called progressive muscle relaxation. This is a good thing to use more so I would say like at night is when I like it, like as you're getting ready to go to bed. You can also use this during the day. It's theoretically also something you could do just like whenever if you were feeling particularly tense. Basically, it entails systematically tensing and relaxing various muscle groups in the body, typically working in some type of order. A lot of PMR videos will go kind of top down or bottom up, or start with the bigger muscle groups like your quads and your chest, and then kind of work to like your fingers and your face. So I'd recommend also kind of pausing, and it's always good as a provider to know what it is you're recommending to other people. So it's important to try the exaggerated exhale or PMR before recommending it. So I'd recommend either pausing or after the video, trying the PMR video I've given you. In the past, when we did in person and students were seated, I used a different video. It was a seated PMR. PMR is best if you're laying down, but you can do it while sitting. So I find that that's important to let people know about too. So I mean, in class, I had students do it while sitting because, you know, y'all are in chairs, you can't really get on the floor, nor would you want to. But similarly, if you were working with someone who is really stressed out at work, it might be more helpful for you to give them a seated PMR link that they could do while sitting at their desk. So all that stuff's good. It's important if you're going to be recommending these things more as like a nurse or physician or someone where like you wouldn't necessarily be walking them through this stuff in session, that you have just like a good list in your head of links that you like, or meditation types of apps that you like that you can easily refer a patient to. You can even record your own on YouTube if you can't really find one that you like. Sometimes I've even recommended that if you are in more of a healthcare setting where your role in this would be more kind of referring patients to services versus walking them through. Like I, as a therapist, might walk someone through PMR, but if you've only got 10 minutes with a patient, you might not be able to do that. So in that situation, I've sometimes recommended like getting like a business card or a pamphlet made that just has like the links or like a QR code on it that you can just kind of give to the patient, be like, these are some really great links. And maybe the QR code is to like your personal YouTube channel, or like maybe your hospital, you could get them to have a YouTube channel that kind of brings together different interventions, and you can just give the patient an easy QR code that they can scan and then kind of peruse the stuff on their own. The easier you make it for people in terms of removing barriers, whether that means walking them through the exaggerated exhale or giving them links or QR code, then the more likely it is that the person's going to follow through versus just saying like, oh, get on YouTube and type this in. Yeah, some high functioning patients might do that, but other patients who, for a variety of reasons, you know, whether that is kind of less health literacy, less access, less trust, personality reasons, may not necessarily take a vaguer recommendation like that. Some other interventions that are great for emotion-focused coping are mindfulness-based ones. In a nutshell, mindfulness is focus on the present moment. So you're not getting wrapped up in like what your to-do list is, or, you know, feeling badly about something that you did yesterday. You're instead just very focused on right now. Typically, we can kind of go about mindfulness in a couple of different ways. We can go about mindfulness from a visualization perspective, where maybe you're having a person envision something. Whether that is something more benign like a forest, or potentially you could use visualization to help a person envision a good outcome, like imagining a person coming out from a surgery and being healthier and stronger as a consequence of the procedure they got done. This type of visualization can promote optimism, and we'll talk about this more so specifically when we talk about cancer later in the semester. But visualization can be a way to help encourage good outcomes and promote optimism. And when doing this, you want to make sure that you are walking a person through an exercise that entails all of their senses. And again, I'll talk a little bit more about that guided imagery kind of approach later in the semester. Meditation is another approach. With meditation, you are shifting your perspective or awareness without judgment. And typically you're shifting that perspective to kind of a mantra or a focus on the body, and you're not really judging, and you're just kind of anchoring yourself in a mantra like Om, or you can meditate on the word health. Or some meditations are kind of more PMR based, where your focus is more on your body and kind of stretching and relaxing in that way. Leaves on a Stream is a really great mindfulness meditation that I'll walk you guys through. That this is something that you probably wouldn't do with a patient in a healthcare setting. You could do it in a mental health care setting, and if you were in a healthcare setting, this might be something that you would again kind of have a QR code or a list of links to kind of give to a patient to either a version of Leaves on a Stream that's on YouTube, or a version that you maybe create yourself. So we'll do this for maybe like 5 minutes, and then I'll do the last technique, which won't take very long at all. So Leaves on a Stream is really nice because it incorporates some elements of visualization, but there's also kind of a meditative, mindful element to it. The aim of Leaves on a Stream is to help people who are having a difficult time letting go of their thoughts. So they have a thought that they're just really attached to, like anxiety about like getting fired, or worry about a cancer diagnosis, or just any run-of-the-mill types of thoughts that they're really attached to. So I like to start off with some exaggerated exhale breathing. So I'll encourage people to take a breath in and exhale 2, 3, 4, 5. Inhale and exhale 2, 3, 4, 5. So closing your eyes, I'd like you to imagine that you are walking through a field. And it's the most beautiful, quaint, serene little field. And as you look around, you notice that the weather is just perfect. It's just the right amount of sun, just the right amount of cloud coverage. The breeze is nice and cool, just kind of tickling your skin. You find that you're perfectly comfortable. And you can feel the soft, cool, wet grass on your feet. And as you walk forward, you notice that there is a small little ridge up ahead, and you decide to make your way in that direction, noticing the sound of the wind against the leaves on the trees nearby. And as you make your way up to this ridge, you notice that just beneath is this shallow little bank along a stream, and you decide to make your way down and sit. And you find just the perfect little spot. Maybe that's on the bank with your feet in the water, or on a soft patch of grass, or maybe there's a nice rock. But you find a space. And as you sit there, you notice that there are leaves floating by on the surface of this stream. And what I'd like for you to do is to imagine that for each thought that pops into your head, that you are plucking that thought out and placing it onto one of the leaves and just letting it float on by along with the leaf down the stream. And you may notice that some thoughts will come to you again and again. If that's the case, that's absolutely fine. It's normal. Don't judge yourself if a thought comes back. Just pluck it out of your head again, place it on a leaf again, and let it go. You may find that you're having particular feelings. Maybe you're feeling bored or frustrated. And if that's the case, just translate that feeling into a thought. So, I am bored, I am frustrated, and pluck that from your head as well to place on a leaf. We want to do this regardless of whether the thoughts are positive or negative. So we're not cherry picking and holding on to the good stuff. The goal is to empty your mind. All thoughts must go. Some thoughts may linger. You might find that certain thoughts, it's like a little leaf that gets stuck in some branches before being rushed away. And other thoughts might zip on down the stream. Whatever a leaf does or a thought does is completely fine. Just let it be, but don't try to speed up or slow down the stream yourself. Your only aim is plucking out those thoughts and feelings, letting them go, good and bad, and the thoughts and feelings that return to you again and again. Continue doing this exercise on your own. And as you pluck that last thought out, I want you to imagine getting up, taking a nice little stretch, looking around, and turning your back on the stream to walk back in the direction from which you came earlier. And as you get to the top of that ridge line and you look down on that field, I want you to take in a nice breath, a long exhale, and then whenever you're ready, open your eyes. So that's Leaves on a Stream. I use that one a lot in therapy. It's a really nice mindfulness approach that, again, the aim is to empty out your brain and just kind of focus singularly on where you are. And it's a nice combo of kind of this meditative, no judgment piece combined with a visual piece as well. As I mentioned before, later on the semester, we'll go through guided imagery, which is more of a process of envisioning good outcomes and how that works. But for now, this is kind of a nice kind of combo of some of these different approaches. I also like to tell people about what I like to call covert techniques, which are ways to be more mindful without the full meditation or visualization. These are helpful, quick, easy ones if you're feeling more stressed in public and you need an option to cope while kind of being around other people, or a quick option. One such option is called Notice 5 Things. Basically what this entails is, again, I like to start with 2 exaggerated exhales every time. Then you want to look around where you are and count out 5 things you can see. So like I can see my phone and a picture and a door, et cetera, et cetera. Count out 5 things you can hear. So like I can hear white noise machine, I can hear woodpecker, I can hear the wind. 5 things you can feel. So I can feel, the chair that I'm sitting on, I can feel the ring on my finger. And you want to do 5 of each. And then you want to collectively go back around and kind of take in all 15 items together. This is a nice exercise because it's challenging you to be more present focused, but frequently when you just tell people like, oh, we'll just like be in the present, that's much easier said than done. It's difficult to stop doing something like worrying or kind of ruminating on thoughts. These interventions are all really good for people who are ruminating, engaging in that damaging type of emotion focused coping we talked about earlier. But frequently, if you just tell someone to stop doing something without giving them something else to do, it's very difficult. And so the counting and the noticing is kind of an activity to do that will kind of quiet those worries. An alternative version of this is called 5, 4, 3, 2, 1. You basically start with 5 things you can see, and then 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. So you can do it a couple of different ways. The number really doesn't matter. It just matters that you pick a number. There's some counting entailed and some sensory experience entailed. So you could do 3 of all the senses, you could do 5 of all the senses. Sometimes some of the senses get tough, like you might not be able to taste 5 things, for instance. So if a patient gets stuck, I just encourage them to keep going. Like the number isn't important, it's just that you're trying. And again, these are really good options for if you're feeling like kind of panicked on like the bus ride to work or school, or if you just like can't stop thinking about the fact that your relative got diagnosed with COVID and like now you need to go into class and really focus. Like this can be a good intervention to just, remind yourself of where you are and what you're doing. It can also be helpful to express emotion. We'll talk a little bit more about the role that certain emotions play in certain disorders later in class, but it can be helpful to identify when it's helpful to feel an emotion and when it's helpful to not feel an emotion. And particularly if an emotion is leading to a bad health outcome or an emotion just becoming overwhelming, those are times to kind of distract. But at the same time, we don't want to just repress all emotion. So it's kind of a balancing act. So how do you tell? Do I feel the emotion or do I suppress it? I like to focus on whether or not the emotion is overwhelming. I don't like to completely ignore any emotion off the bat because emotions are helpful. They're telling us bits of information about what's going on. For instance, we feel happy and sad for the same reason. It's because something or someone's important. We feel happy when we have that person or that thing, and we feel sad when we don't. We feel angry typically during some type of boundary crossing or value violation. Someone does something that just doesn't speak or agree with kind of our personal code of ethics. we feel anxious, scared, when there's something threatening survival potentially. It really kind of goes back to a fear of death and something's threatening, and so we're feeling anxious for that reason. So it's always helpful to attend to the emotion, to pay attention to like why it's there. That being said, sometimes an emotion becomes overwhelming, or sometimes it's not really a good time to have an emotion. Like maybe you're feeling really sad about a sick relative or a personal health diagnosis, and you're at work, and you've got to answer the phone, you've got to teach, you've got to keep doing whatever it is you're doing. You can't really focus on this right now, and so that's not a good time. Or alternatively, maybe you've been crying, you've been feeling sad, but we're going on like 12 hours now, we're getting to the point where it's overwhelming, so maybe we need to move on. So what I like to do when I'm feeling the emotion, when the time is right, when it's not yet overwhelming, is to set a timer and do what the emotion tells you to do. So if the emotion tells you to cry, watch a sad movie, cry in your room. But if you have a tendency to overdo it, set a timer. So it's like, you can cry and do what you want. You can be scared and kind of hang out in your room, but you can do that for 2 hours. You can't do that forever. And that, after that, we've got to get up, we've got to pause that emotion and go do something else. So, get out and go socialize, do the opposite of what the behavior is telling, what the emotion is telling you to do. And sometimes you go back and forth. Sometimes while you're kind of coping with sadness, it's alternating between being sad and crying it out with a movie, and then kind of hitting the pause button on the sadness and going out with a friend or going to work and like doing what you've got to do, or doing what is going to make you feel better. So I like to do that kind of stuff. Sometimes it can be helpful to find an activity that can be a way to kind of pour your emotion out. Exercise is a good alternative for a lot of emotions. So go for a run, go work out when you're sad, when you're angry, when you're scared. Art is a good way to express emotion as well. But you can really get creative and do whatever. I had a client once who had some pretty significant kind of fibromyalgia style pain. And so a lot of things were really difficult. And she previously enjoyed exercising, but she couldn't really do it anymore. And what we ended up identifying for her to help with her anger was the dishes. So every night when she did the dishes, she just really poured all of her frustration over her fibromyalgia diagnosis into like really cleaning these dishes. And she couldn't control her fibromyalgia, but she could control how clean these dishes got. And that was a really helpful intervention for her. So you can get really creative with this one. So I like to set some timers, some boundaries around the emotion, find a good activity that will help you express it, do it. And then if we're kind of getting into overwhelming territory, or territory where maybe this isn't a good time to feel that emotion, just kind of distract. It can be helpful to remind yourself that like, it's okay. Like, it's not that you're never allowed to be sad again. You just can't be sad for the next 8 hours. We can be sad later. And that can be helpful as well. And again, these are things you could talk through more in a mental health setting, but these are also some basic things you could talk about in a healthcare setting in like a minute or two, like explaining that it's not helpful when it's not a good time, and it's not helpful when it's overwhelming, but that ultimately it's a good thing to feel emotions, and pick an exercise to pour that emotion into, whether that is physical exercise, art, doing the dishes, whatever. Several factors impact our ability to cope. One of those is gender. Men typically prefer problem-focused techniques versus emotion-focused ones. This is very much a social construct. This isn't like a testosterone or biological thing. This is that, men are socialized to disengage from their emotions more. At the end of the day, though, because we do know that emotion-focused coping is helpful in certain situations, research does indicate that a lack of emotion-focused coping, when appropriate, can worsen health. So for instance, men with prostate cancer who don't deal with how they're feeling can actually have worsened urinary function than men who were able to cope. SES is another thing. People who have a lower SES are typically more hopeless, have less psychological control, which, as I've mentioned before, is a privilege in a way. I find that given the right perspective, you can typically find a degree of control in most situations, but there are certainly some that are much more difficult and challenging than others. and fewer resources too. So all of these things set the stage for less problem-focused coping, because problem-focused coping is really about having sufficient resources, and low SES frequently means insufficient resources. So that's something to be aware of as a provider, and that in this situation, you may be able to provide resources in the form of referrals or advocating for various services being added to, the menu of services that you offer at your work. But then this might be a place where you intervene more with emotion-focused coping. Social support is a big one. It improves coping by increasing capacity. One caveat is it might not be helpful if it's not perceived as beneficial. So for instance, if you've got like a patient who's got kind of an iffy relationship with their mom or their sister, and your patient's kind of recovering from like a mastectomy, suggesting that, those people come over and help when that help might not be really perceived as particularly helpful or beneficial, might not really be the best way to go. It's always helpful to kind of talk through some of this stuff and ideally set up boundaries so that if social support becomes unhelpful in a situation where it's reasonable to think that might happen, that the patient can kind of speak up and the other person will understand and leave. But most of the time, 9 times out of 10, social support's helpful. Just occasionally, it may not be. The social support piece is also the driving factor between the link between spirituality and religion and health. Generally, people who are spiritual and religious have better health. There are a variety of reasons for that, but one of the reasons is that typically, most spiritual religious pursuits entailed some type of social link, whether that is kind of a formal religious gathering like a mass or a service, or even just kind of a spiritual community, or feeling a connection to something greater. And so social support is one of the driving pieces behind that link as well. Another thing to acknowledge is that personality plays a role in coping as well, as I mentioned earlier. In particular, there are 3 traits that contribute to improved coping, and those are commitment, the challenge perspective, and control. So again, things that we've talked about before. And collectively, these traits make up a personality style called hardiness. And hardy people are committed to their jobs, their families, their communities. They view everyday demands as challenges, and they have a sense of control over their lives, even if that's just something like shifting their perspective to, I'm in control of whether or not I take this class. This isn't something that's happening to me. This is in the service of something bigger that I want. So people who are hardy tend to be healthier, less likely to be reactive in stressful situations, and they tend to adjust better to health problems, even when they happen, things like cancer, heart disease, diabetes, HIV. Hardiness is the pathway to resilience, resilience being the ability to bounce back from stressors. So these people are better able to recover and sometimes even emerge from a stressor stronger than they were at the beginning. There are several different explanatory styles as well that contribute to coping. An explanatory style is basically whether a person attributes outcomes to positive or negative causes, so pessimism and optimism. Pessimism is a negative explanatory style. Typically, these folks explain failures in terms that are global, stable, and internal, meaning everything is awful, it's always going to be awful, and I'm awful as well. Specifically, when people think in global, stable, and internal ways, that is what cognitive psychologist Aaron Beck referred to as his cognitive triad, and he believed that when people thought in these ways, that was the route to depression. Pessimism is also associated with anger, hostility, suppressed emotions, anxiety, and harmful health-related behaviors. Optimism is a positive and upbeat explanatory style associated with healthier and longer lives, shorter stays in hospitals, faster recoveries, less inflammation and cardiovascular problems. The broad and build theory also suggests that optimism facilitates increased coping capacity, physically, cognitively, and socially, and that this improves coping and health in the long run. So basically, the broad and build says that people have better health outcomes as a consequence of optimism, because people who are optimistic have a greater tendency to kind of reach out and cope and help in helpful ways. And so the broad and build theory is kind of another indirect theory where we're kind of supposing that the mechanism acting in between optimism and good health is helpful coping. Okay, and that is all that I have for you guys.